So what are the most common sports injuries, and does being physically fit help prevent them?
Those are among the questions our guest will help answer on this week's Health Talk. Stay tuned. We're up next. Hello, I'm Dr. Vicki Smita.
And I'm Dr. Eric Mazer. Today we'll discuss sports medicine with Dr. Mark Fletcher. He's an orthopedic surgeon, fresh to the area with Coastal Orthopedics. Welcome to the area, Mark, and welcome to the show.
Well, thank you very much.
Yes, it's nice to have you, and we have a fun topic too. Well, fun because it's sports and exercise.
And it applies
Not so
to
fun.
almost everybody at home, old and young.
That's
Yeah,
right.
but tell us what got you interested in sports medicine, and what is sports medicine, and how did you get involved with
Well,
it?
I originally got involved in orthopedics. My father was a physician and not an orthopedist, but it got me interested in medicine. But I was an athlete and was an athlete for a long time into my 20s and 30s. And that kind of just drew me into it. It's I think a lot of orthopedics, it can be said that they either were injured or they're athletes or they had some problem, and you kind of,
It's a perfect way of combining your avocation with your vocation.
Right,
Absolutely.
exactly right. And then, so sports medicine seemed to be a natural fit, and it's always something I'm interested in because you are what you do, and I like doing, I like being a part of sports and being active, and it just happened to be something I work at now.
And of course, we're not just talking as someone on the older side of the group that's here today. We're not just talking about the young athlete who gets an injury in playing football or competitive soccer, but we're really talking about us as a population as a whole. As we age, I think my generation is a lot more involved in sports and athletics than the generation before us, and that puts some extra stress on our
Well, I think you're exactly right.
epiphyses and other things.
You got it. I think every successive generation has been more active, and so people want their quality of life and their quality of activities to persist. In their 60 is a new 40,
Right.
and those
I'm
kinds
glad
of
to
things.
hear that.
People are right. But people want to be more active, and they want to do more active things longer and longer and longer. And that really, all of it is encompassed by sports medicine. So it's really the treatment of an active population. So it really
Did this really exist 50 years ago as a field of medicine? Now we're saying people are more active now.
Yeah, well, it's come like everything else. As people learn more in medicine, from any part of medicine, things have subspecialized out, and as people have become more active in sports and kind of pastimes,
Right.
those things have been teased out. Certainly with the rise of professional sports and high level scholastic things, as those things have developed, the things that support them, the healthcare at least that supports them, becomes more of a specialized thing, and that's just been the evolution.
Right.
And it's interesting because I think even the amateur athlete has adopted some of the psychology of the not professional,
Sure.
but the competitive athlete. So the amateur athlete wants to
You
get
wanna
back
train
after
hard,
an
you wanna
injury,
be
just as much as the college basketball star.
You
may.
got it. And it's kind of like a trickle down. Even the injury prevention and the injury treatments certainly trickle down. Last year's high level sports injury and treatment becomes this year's kind of everybody's treatment. Tommy John 20, 30 years ago now, Tommy John's a very common name for pitchers and people who hurt their elbows. It's no longer just on professional pitchers. It's become commonplace. It's not as common as thankfully it's not as common, but it's certainly something that's done quite commonly in high school athletes and collegiate athletes, not just the pros.
So one of the questions I asked during the teaser, what are the common sports injuries?
Yeah.
Are there specific sets of injuries that are common? Are they more injuries that go along with different sports, or are they stratified by age? Do you see different things happening in my age group than presumably you do, than in a 30-year-old or 20-year-old?
Absolutely. The common things happen commonly. So ankle sprains, you don't have to be an athlete. You can just trip on the sidewalk and ankle sprain. So the common things that happen commonly certainly are no different in any kind of sporting arena. But then when you break it down by sports, baseball players tend to get a lot of shoulder problems. Skiers, they have certainly a lot of knee problems and fractures along with that. Basketball and soccer, ACL injuries, as well as common ankle sprains. So you can stratify by sports, but you typically see common things commonly. So I would say, the sprains and strains in non-operative treatments, hamstring pulls, those are very common because you can treat them and they don't take you out for very long. Other things like ACL tears happen across many sports, and those are
Let me ask a very basic question.
Yeah.
People always talk about strain and sprain. What are they? Other than something that's hurt and not broken.
Well, when you use them talking to people, it goes back and forth. So I always think of muscular strain. So it's muscle fibers being disruptive, and ligament sprain. And literally, it's just the same thing as ligament or collagen fibers being disrupted. So it's a semantics thing. But
Can you see those on an MRI? Not that you should be.
You can.
But you can actually see the
Yeah.
pulling of those fibers.
Yeah, you can see an injury just like anything else. So just like when you look at something that gets sprained or strained, it swells, it may be black and blue, and it gets a little larger. You can see those changes in MRI, and so and you can even grade them. When you look at someone clinically, you can grade them. It's either not very big, or it's pretty moderate, or very severe. You can actually grade them.
Maybe
on an
starting
MRI.
with that, I don't mean to dominate this, but starting with strains and sprains, are there a standard approach to caring for them? They are so common. You twist your ankle, you pull this,
Right.
running too fast, and you haven't run before. What's your approach to them?
Well, those
People talk about ice,
yeah.
heat, rest,
Yeah, well,
stretching.
it's also another evolutionary thing. They used to, you've injured this, let's immobilize it. Well, we found over time with research that immobilizing is not very good for these things. You lose muscle mass, you get stiff, and so for most strains and sprains, we emphasize movement, comfortable movement, not re-injuring it, but get the range of motion back in a reasonable time. You want to control inflammation, but not eliminate it, so ice and elevation to decrease the tissue swelling. Use of anti-inflammatories is a little controversial. You use them too early, they make you bleed a little bit more, but if you use them late, they can maybe slow down your healing. So you use them as a tool, just like all these other things. But mostly sprains and strains, early protected motion, and then strength and functional strength to get someone back to sport as they're able to. And usually it's about a 6-week to 8-week sequence.
What would you
And that's
say-
a substantial amount of
Yeah.
time. That's interesting. So sprained ankle.
Yeah, well, there's a sprained ankle that you roll and walk out versus a sprained ankle that you can't walk on. There's a huge continuum of how bad something can be.
Right. Give us some guidelines for our viewers at home as far as, okay, you have an injury, and let's assume that it was obtained while engaged in some kind of a sporting activity. When should you go to a sports medicine orthopedist or doctor versus your regular orthopedist that you might have seen in the past for something else? What are some guidelines? It matters, obviously. I was going to say, does it matter? Obviously, it matters. What are some of the differences?
Well, so I think if you think about the strain or the sprain or the injury that happens, that we've all dealt with, you're sore for a day or two and then it slowly fades away. Certainly, that's something that the intensity of the pain or the injury doesn't go away in a couple of days. Your inability to walk, that's a big one. If you can't put weight on your leg or you can't use your arm comfortably without pain, and that doesn't seem to resolve in a day or two, I think that's something that should be followed up.
But this is
on.
very helpful because people sprain their ankles all the time. The question is, when should I go see a doctor? Are you really saying,
the biggest
see
one
what
is
happens in a day or two?
Well, I mean, if you can't walk on it and put pressure on it at all, I think that
Go right away.
bears evaluation pretty soon. Or if a joint swells up suddenly or becomes very bruised, that could indicate a fracture or a severe sprain. But things that hurt, that ache, that make you stiff for a day or two, you can move, but you're not quite as good as you were. Those things, I think, those are reasonable to watch and use the kind of time-honored principles of resting it, controlling inflammation with ice, a little compression and elevation. Those things I think are reasonable, and if those don't recover in a day or two, maybe you should start thinking about severe swelling, big black and blue. I think the biggest one is you can't use the limb or you can't step on it. And pain too. If it's severe pain, I think that should be checked. But there's a lot of things that we deal with routinely
And
that we just accept. So a lot of it's commonsensical, but those are some pretty good points.
How about shifting gears a little bit to the younger population? You probably are involved with, or you get to see young people who are involved in sports, whether they're on teams or whatnot. Do you see a lot of overuse injuries in younger children or adolescents these days than maybe we were seeing 20 or 30 years ago?
Well, I think as a profession, I think orthopedics is seeing that a lot more, and that's the rise of more, like I said before, last year's or a couple of years ago, professional sports, that training system is now available to younger and younger people. And so you have club sport and adolescent sports that has become more intense. So most people do just fine, but we do see a subset of people who come in who just don't stop. They've got multi-sport involvement. And so unfortunately, yes, those kinds of things are seen a lot.
And could you give examples of that for people? What kinds of,
Yeah.
what do you mean overuse injuries and the sporting involved?
Stress fractures, so overuse for running or jumping, stress fractures or shin splints. People who have overuse, like chronic tendon changes in their ankles or their knees, those are quite common for running. Overhead athletes, we have throwers can get persistent shoulder pain that could either be a growth plate injury or or just a bad tendon overuse. So these are just overuse things. You're basically going beyond what your body's ability is to repair, and so that's part of a normal.
It's really saying all training is not necessarily good training,
right,
or repetitive training with the same motion.
Well, it's like anything else. You need an appropriate dose of stress or athletic input into your body to get good change. But an overdose of anything is like an overdose of medicine. Too much of a good thing is not necessarily
it's not a good thing. Right.
Yeah, and your body will break down. So thankfully, most of us don't have to deal with it, but it's certainly a specter as you get better and better with whatever your activity is, whether it be walking or running or swimming. If you don't give yourself the necessary rest in addition to the appropriate dose of exercise, you can find yourself going over the curve and starting to break down.
Yeah, and I think that's a good take-home message to everyone who's watching the show, that everything is good, and training hard for sports is good and it's important, but it has to be moderated by some time off to recover so that the body can heal.
That's right.
Yeah.
And I think most people who are not in high-level athletics who just want to be active, I think the most important thing is just to be consistent, number one. So if you want to get benefit from something, you should do something you like and do it often, and establish some sort of fitness level. And then as you get better at it, or you become consistent, or you find that I really enjoy this and you want to do better, you go out for a walk, but then you want to time your walks, or you go for jogs, then you want to go for like a 5K. When you start getting into a regulated training program, that's when you have to start thinking about what's the intensity of my exercise, how much do I need to rest, what kind of variety should I put in my training, and those are exactly how Olympic athletes or high-level athletes train.
Right, and you should maybe have someone to help you come up with those goals, at least in the beginning, as you're getting familiar with the exercise.
At some point, I think for most people who are just getting into some training, I think, being consistent and exercising is great. But when you start having goals and you want to pursue things, that's when you may want to ask someone who's done it for a while, hey, what kind of training program have you done? How can I apply it to myself?
This is a perfect segue, because during the next segment, we're going to talk about the prevention of injuries, and I think some of the proper training schedules and proper expectations. So please stay tuned. We'll be back after this short break to talk more about sports injuries and sports medicine. Hi, Vicki and I are back with Dr. Mark Fletcher. Mark is an orthopedic surgeon and a sports medicine specialist. We're talking a little bit about training, and when you want to improve your condition, beginning to set some goals. Maybe you could talk a little bit about that and how it's important to set realistic goals and gradually increment your training upward.
Right. Well, I think, first of all, you got to do something that's fun. We're talking about, every person, right? We're talking about people who want to get into something, not the hard-driving collegiate or high school athlete who's just, wants to grip something and go for it. People who have jobs, but they want to get healthy, but there's things they like to do. You got to
talk about exercise all the time, so we're really talking about everybody.
You got it.
Whether you're a great athlete or you're, barely can walk one foot after the other.
Yeah, the rules apply to everyone. You got to be passionate, or at least have fun at what you do.
You have to enjoy it.
Yeah, you got to enjoy it, because nobody's gonna. I tell people all the time in the office, find something you like to do, because as soon as it hurts or you don't like it, guess what you're not going to do? That thing right there. Right. So if you want to do an exercise program and get involved, you want to do something something you like, whether it's dancing or going out, doing some group activity. You got to fix something you like, and then as you get better at it, and you want to start training at it, or you set some goals, you may say that, I want to be able to dance in a contest, or I want to run a 5K and not stop. As you start setting goals, then you just you build a plan to it. Now, there's a lot of stuff available. The internet is a fantastic resource for many things, but as you get farther and farther,
but a dangerous one also.
You got it. There's no filter on that. You can get anything you want.
Good information looks just as good as bad information.
So a lot of times you just sort of find the people who you're around who are doing the like things or a little farther than you, and see where they are and see how you can get there. But regardless of whether you're just starting or whether you're going to compete for the Olympics, it's you got to be consistent. Then you got to make sure your intensity is appropriate, and you make sure you rest. Most people, we rest plenty, but when you start working out, you're most of the days working out, only a few days rest, then you have to make sure you do something that's at least alternative rest, or at least you're not doing the same thing over and over and over. So the variety comes in there, and it keeps your body fresh.
How do you know, though, especially if you're not an experienced
Right.
athlete, how do you know if you're doing too much? I mean, one way, obviously, is that your body
Right.
hurts the next day,
You
but
got
that
it.
could also be construed as a good thing.
You got it.
Because you did exercise the day before, so now you're feeling it. But then, should you rest the following day?
Right.
Should you alternate days? And
Right.
what's a good approach, or how should people be thinking about that?
Well, it's one of those things where you have to learn your body and how it responds. When you start something new, if you go into it so hard that you can't move for a couple of days,
That's not a good
that's
sign.
not a good
Right.
thing, right?
Okay. So
And
common
it's-
sense
Right,
prevails.
common sense.
It also will condition you not to do it again.
Right, then you won't like it as
Yeah.
much as you did the
And
first time.
but one of the overriding principles that I always found from my own athletic careers, the people who went the farthest had the least amount of sick days. They didn't get hurt. And so I think the principle of being able to show up every day and doing something is important. So you want to make sure you're confident enough to exercise, but also confident enough to not overdo it.
Right.
So you do what you can do today, show up healthy tomorrow, and then if you can, is it appropriate to run all 5 days a week or 6 days a week? Well, sure, you can, but you have to vary your training. You can't just go out and run 10 miles every day because you'll break down. Even the best runners, they'll go and do hard days, and then they'll go and do long, easy days. So
Right.
you have to vary your intensity in training. You can't just show up
So
and
that's
do the
one
same.
of the general rules for healthy
got it.
exercises, varying your exercise and varying the muscle groups, the
You got it.
intensity.
You can even lift weights every day if you want, but you have to vary the weights involved, the muscle groups involved, and you can certainly go to the gym every day, but you have to give yourself a break. You're still training those muscles, but you're not focusing specifically on those.
How about
Right.
warm-up and stretching, and what role does that play in preventing injuries?
Well, certainly when you're warm and ready to go into an exercise, your risk of injury decreases. Now, as to what exactly is the best warm-up, you'll find about as many answers as there are pages, in the phone book. But I think generally that a general warm-up, just moving around, loosening up, warming your body up, getting your body ready to exercise is more appropriate than sitting down and doing any specific stretches or any one thing. I think prior
We
to
should do a lot of touching our toes and
Right.
and
and it's
jump.
hard to do cold.
Yeah.
Yeah.
So usually most people I think most people would suggest moving around some sort of general exercise for 5 or 10 minutes. If you want to do some stretching, some people say you can do some static stretching. Other people say, well, it's better to do functional movements like arm swings and leg swings and gentle jogging.
Just to get that mobility.
Just to get some
Yes.
mobility, but an active mobility.
What does that do to the muscles, to the tendons, to prepare them for exercise?
Well, it increases their heat, it increases their blood flow. So it really allows the muscles to have a physical change. When you're walking around, your body's just sort of on endurance mode. You're in gear 5. There's no, you're just moving around.
Right.
And so what you're doing is you're allowing the muscles and the blood supply of the muscles to increase. You're actually increasing the ability of the muscles to have blood flow. And so it's just like warming up an engine, and you're just allowing the muscles to sort of shift into an active
Then
gear.
does that say something also about when you begin to exercise, if you're jogging or
Yeah.
using an elliptical, for example, that you should start slowly and build up that intensity as
Yeah.
you go forward?
Yeah, I think
So-
the first 10 or 20% of any exercise should be developed to warm up because your body is still adjusting to the new challenge it has. And I think that can be applied to just about anything. Just to watch a football team warm up before they play a professional football. They're on the field for half hour, 45 minutes, just running, doing drills, doing simple things before they do intensive things. But you can parlay that or kind of extrapolate that to someone who just goes out to jog in the park, walk around, talk with your friends, move around, have some non-specific exercise, and then say, okay, time to set the watches and go. So I think that's very important, and it doesn't have to be super specific. On the end of the the workout, the warm down, I think it's also important to do a proper warm down. Let your body kind of come down from that excited exercise state, allow things to sort of calm down naturally. At that point, a little bit of stretching and flexibility actually goes a long way because you're kind of resting, you're allowing the muscles to kind of return to normal, but giving them a little extra help.
Right. Now, in your world in sports medicine, in addition to questions you probably get asked, obviously, about injuries and prevention, do you also get a lot of questions about nutritional supplements or amino acids in terms of,
Sure.
should I take this because
Yeah.
will it help prevent muscle breakdown? Will this help me build more muscle mass or better endurance or whatever the case
Yeah.
may be? Maybe you can talk a little bit about
It's
that.
a little bit of a murky science because there's a lot
Yeah.
of food supplements out there. Not all of them have been tested. I find that the one thing that people don't do when they're coming to talk about supplements or things like that, they don't attend to their own diet. I mean, even taking vitamins, it's much easier to get the vitamins and the nutrients you can get out of your normal diet. They're much better absorbed. They're much easier to get. It's probably a lot cheaper.
Right.
So I tell people
It's probably more effective.
Right. If people are worried about nutrition, I tell them to take a multivitamin. I also ask them to take vitamin D, and that's a very important one. Most people, and I don't want to break off your great question to just vitamin D, but vitamin D is essential in like the northern hemisphere in the winter. Most people are vitamin D, but it's got strong correlations to actually improved athletic performance. Some very old data, So most of when I was taking care of my running team back in Oregon, they're elite runners, and we tested all kinds of parameters, but one thing was vitamin D, and you want to make sure vitamin D was at least in the mid-range, because it'd give them, it's essential for bone metabolism. You're trying to turn over bone and get stronger. Without vitamin D, you can't do it. Your risk of stress, fracture, overtraining, injury shoot through the roof.
Is there enough vitamin D in a typical multivitamin tablet with the 400 units you need?
No, 400 IU is recommended by the FDA, but that's really to prevent rickets and like really low states of vitamin D. So I
you
think
need much higher
Yeah,
levels.
I think so. I think most people would be better off taking 1,000 to 2,000 IU, which is international units. Yeah. And when we treat fractures, we typically put them on higher doses, just for a short period of time. But that's a simple blood test. If someone's really serious about it and they want to know, it's a good thing. It's a very easy thing to check out when they go to their primary care physician when they're getting their own.
And now everybody gets tested for vitamin D deficiency. Right. So, but it's interesting to hear how that correlates with.
So I think vitamin D
prevention.
is one. A multivitamin is very good, and then it's just an adequate source of lean health protein. Vegetables. Lots of vegetables which are high in nutrients and good carbohydrates as opposed to empty carbohydrates. Now you can have carbohydrates, but if you look at your diet or you track a diet, it's very easy to overload yourself on stuff that just contains carbohydrates and sugars and nothing else. So
and you're not really realizing you're doing it unless you start tracking.
Plus, the biochemistry of spiking your glucose too high, your blood sugar too high, too much insulin, it falls, you get hungry.
All these things are, they're incredibly beneficial.
Now, how about, we only have a couple of minutes left, or less than that, the older athlete. So rotator cuff's getting a little ragged with time. There's not quite as much cartilage in all the joints anymore. So how does one go through their 50s and 60s and keep active without getting into trouble?
Well, a lot of it is just understanding what your body's been through, what kind of injuries have you had, and where your weak points lie. A lot of it is just sort of starting something easy, and just understanding that you may not be able to lift as much as you did 40 years ago or even 10 years ago. And so you have to adjust to what your body can give you. So a lot of it's commonsensical. Do stuff you feel good doing, do stuff that makes you feel good, incorporate some cardiovascular training, whatever that may be. It could be running, it could be elliptical machine, it could be walking or swimming, and then trying to get some sort of resistant exercise in there. And that doesn't have to be weight training. It could be all kinds of functional exercises that incorporate some resistance. Really, it's whatever you like, and you just want to make sure you're doing it well and making sure you're not waking up things that used to be problem. I tell people, 50,000 miles on the car doesn't mean you can't drive it every day. Your maintenance interval has shortened, though, so you have to do the right thing. So you may have to attend to certain things. If you're doing rotator cuff, you have to make sure you have to do some rotator cuff specific exercises to make sure that's not getting overused. And so you just have to know where your weak points are.
So I'm hearing try not to relive your 30s when you're
that's right. That's the big deal. Well, the problem is that the brain doesn't age as fast as the body. We know the
brain doesn't age at all.
Yeah,
I'll let you know that. From my perspective.
Yeah, we take that step real quick, and then our bodies all of a sudden realize they can't do it. That's one of the big reasons people come in for us.
And that's all we have time for. That's wonderful. That's really all helpful information.
This was very informative. Thank you.
Yeah, very, very. When we come back, we'll have today's health question.
But right now, let's take a look at some of our upcoming events. This week's viewer question is, what is runner's knee?
And we have an expert here to answer the question.
Yes,
What
we
is
do.
runner's knee, Mark?
Well, the short answer is runner's things is a lot of different diagnoses kind of all grouped together. It's all pain in the extensor mechanism, which is essentially the thigh, the muscles of the thigh, the quadriceps as they interact with the kneecap and the patella tendon. It's essentially overuse. And so it's the same thing. You're running too much, you're running too long, your intensity is a little too high for what you can deal with, and over time the tissues around, the muscles and the tendons around the front of your knee either tighten up or they become painful. And so it could be quadriceps tendonitis, it could be a problem with your IT band, which is a tendon on the side of your knee, all kinds of things, but it's essentially in the front of the knee, and it's worse with increased running. And it's treated by appropriate rest, appropriate range of motion and flexibility through the knee and actually the hip, and then attending to appropriate core strengthening, and then bringing your running intensity slowly back up to what's appropriate, and then bringing it up as you feel healthy.
Can it come back and re-flare?
Absolutely. Any overtraining injury can come back, and especially if you've had it before, you may be set up to have it again because you're sort of falling back into the old trap, and that's why the therapy and the rehabilitative part is so important. Because it has to, that will be a weak point for you for a while, but it doesn't mean you can't work through it.
Yeah, I remember 20 years ago I used to get terrible pain in my knee that I actually saw an orthopedist for. They said it was the patellofemoral
Exactly
chondral,
right.
and did some thigh strengthening, and
You got it.
have never gotten it back.
Well, most people, what they'll do is they'll just rest till it goes away, and then they'll exercise again, and it'll flare up again. They can't understand
Because
why it
they
didn't go
haven't
away.
really
Well, they didn't
addressed
really, they didn't treat the cause.
Right.
They're treating the symptoms. So you have to get back to the cause and work through that.
Well, that's,
Yeah.
Well,
I
that's
now know
very
what
helpful.
runner's knee is. Thank you very much, Mark. If you at home have a question you'd like to ask on Health Talk, please contact Vicki and me at healthtalk@norwalkhealth.org.
Eric and I would like to thank our guest today, Dr. March Fletcher, for coming on Health Talk.
We'll see you next week on Health Talk. Keep exercising.